Today, we're talking about a symptom that stops most people in their tracks. The moment when breathing, just doesn't feel automatic anymore. The average person's mind jumps straight to the worst case scenario. I'm Nurse Healy. I've been a registered nurse who's spent a long time helping people make sense of symptoms that don't always come with clear answers. Let's walk through this together, because you shouldn't have to face this alone. Anxiety can affect breathing, but sometimes shortness of breath requires real medical attention. Knowing the difference gives you the control and eliminates the fear. So, anxiety activates your fight or flight system, right? This causes your breathing to speed up and your chest to tighten. Your throat starts to feel kind of restricted. Your body forgets how to breathe slowly. It's all escalated, right? And if you could look at yourself, you'd be rapid breathing at this particular time. Because breathing is essential, any disruption feels, absolutely terrifying. The sensations just mentioned are frequently linked to anxiety. Feelings like not feeling like you can get a full breath and you can't inhale fully. And you have this sensation of tightness across your chest. Your breath is rapid and shallow, and you get this lump sensation or tightness in your throat. You might feel lightheaded, and you have tingling in your fingers and lips. You get these sudden waves that kind of peak and pass. These feelings and sensations are frightening, but they're seldom dangerous. They're signs of your nervous system being stuck in high alert. What you're experiencing with your breathing, you're not being dramatic. You're not imagining any of this. Shortness of breath ranks among the most distressing sensations a human being can experience. And that's just biology. It's sprinkled with apprehension, especially if you're dealing with it alone, which just magnifies everything else too. There are times when breathing changes are a medical emergency, and I highly advise seeking immediate medical care if you have sudden shortness of breath, especially when you're at rest, worsening breathlessness with minimum effort. You have chest pain when you're breathing, your lips turn blue or gray, and as well as your fingertips. You have new confusion that's out of nowhere and maybe extreme fatigue. Potentially you could be coughing up blood. One of the big ones is if you have swelling in one leg and new onset breathing troubles. Shortness of breath after an injury or any form of trauma. These are not wait and see symptoms. They matter. This is the part that trips people up. Symptoms like chest tightness, fast breathing, lightheadedness, fatigue, anxiety that spirals, a sense that you're hungering for air, you just can't get enough air, can be anxiety, or it could be something medical. This is where people hesitate. They're afraid to overreact, but they're equally afraid not to. And this is where calm guidance matters. This is a gentle check-in, certainly not a diagnosis. If your symptoms ease within 1 minute of slow breathing, they're often anxiety-driven. So let's try this. You're going to inhale for 4 seconds and exhale for 6 seconds. We've done this before in previous videos. You're going to repeat this for 10 times. If your chest starts to soften or your breathing eases and your panic drops, your nervous system is likely the driver of all this. If symptoms don't change or they worsen or include other red flags, you need to be seen by a qualified healthcare provider. By the way, this isn't a test. It's a compass. So let's make this doable right now, tonight. Number 1, name it. Okay, this feels like anxiety. Well, naming it helps reduce the fear loop, right? Number 2, slow breathe. Let's go back to the inhale for 4 and exhale for 6. Do that 10 times. And 3, ground your body. Look at 5 things. Name them. Look around your room. Name each one of them. Touch one of them if you want to. Exhale slowly. That was a candle. That was a picture. Whatever it happens to be. This resets your nervous system, not your imagination. If shortness of breath happens frequently, limits your daily life, wakes you from your sleep, or sends you repeatedly to the emergency department, you deserve a proper assessment. And you're not wasting anyone's time. You're just seeking answers. If fear about your breathing keeps you up at night, this space is for you. Ask your questions privately, without judgment. You don't need to leave your name. Just ask. And if this helped you, share it with someone who's struggling quietly. It helps these conversations reach the people who need them the most. Look, I need to say this, and it's important. This video provides general information only. It does not provide personal medical advice, diagnoses, or treatment. Please check with your own personal healthcare provider about your own specific situation. I'm here to help you understand your health, not to scare you, sell you, or promise miracles. Just truth and a steady hand. Well, look at that. It's time. The sooner you understand what your body's trying to tell you, the sooner you can stop living in fear of it. Thank you for being here, and thank you for trusting me with your time.